60,000 assisted reproduction procedures, delivered over 60,000 babies, and brought joy to over 7,000 Sri Lankan couples around the world.
Dr. Haripriya has presented numerous papers on assisted reproduction, delivered lectures on the subject on national and international forums, and of course conducts regular workshops on the updating technologies in assisted reproduction. Her trailblazing work has earned her numerous accolades, some of the most notable recognitions being the Lifetime Achievement Award by the CII Tamil Nadu Healthcare Excellence Honours 2024, and another Lifetime Achievement Award by the Goal Committee in collaboration with Harvard University. A true leader, healer and advocate for women's health, please join us in warmly welcoming Dr. Geetha Haripriya to deliver the welcome address.
A very warm welcome to you all. It gives me immense pleasure to welcome all the dignitaries, the Honorable Governor of the Western Province, the Chief Priest of Sri Lanka, and all the other esteemed guests who have come here to bless us on the occasion of the inauguration of the Royal Prashanth Fertility Center in Velavete in Royal Hospital, Colombo. The whole story started with my own history of infertility of 14 years. It was a very long struggle with multiple procedures, multiple attempts, and at the end of 13 years, I decided that I would go to the United Kingdom to continue my treatment. I also went to take my exams for the Part 1 and the Part 2 MRCOG. I succeeded in all my exams, first shot, but I failed miserably in my fertility tests. We tried once more, and the fourth time was successful, and Prashanth was born. When Prashanth was 1 year old, I decided that it is time to give the couples in India a chance, the best chances to achieve their fertility dreams, and I went to the United Kingdom for a couple of years to train in infertility and endoscopy. I visited 15 centers in the United Kingdom. I did locums. I learned all their technology, their expertise, and all about the equipment with the idea of coming back and setting up my own center in Chennai. So in 2001, we started Prashanth Fertility Research Center with the best of technology, with the equipment sourced from all the best countries in the world, and the doctors I trained, but we found that there were no qualified embryologists across the country. So I decided to partner with Sydney IVF, and I worked with them for 18 long years when they would send an embryologist every month. And this brought us to the top of the success stories, and we had one of the best pregnancy rates, and this was possible because this was a mirror image of the center in Sydney IVF with all the highest technology worldwide. So we actually worked with them for 18 years, and it became one of the best centers worldwide, and people came from all over the world, all countries, Sri Lanka, Bangladesh, Maldives, Mauritius, Africa, America, and Europe and Australia. So there was no country in the world which was not represented, and all this was because of the technology and the superb pregnancy rates that we were able to give. So when they finished all their free attempts in their country, which was offered by insurance, they would all come here, and most of them went back with smiles and babies. So my first Sri Lankan patient was Dr. Jamil, who is among us here today and who will address you later. And they succeeded in their first attempt, and the twins today are doing their 4th year of medicine, and this was one of the first success stories from Sri Lanka. After that, Sri Lankans from Sri Lanka and worldwide came in large numbers, and as of today, we have delivered 11,000 babies in Sri Lanka and Sri Lankans worldwide. So we were able to do this because of all the high technology that we put into our systems. So we selected the best sperm by looking at sperm 7,000 times big, and that is called IMSI. We selected and created the top class embryos by using the embryoscope, which is designed like the human body. We use the lasers to hatch the embryos, and we used embryo glue to help the embryos to stick onto the lining of the uterus. And today, there is a huge problem of a diminished ovarian reserve, which means young girls in their 20s are unable to produce eggs, and this is because of the environmental toxins and other plastics and other things which are there in the pollution system. And therefore, we introduced the mesenchymal stem cell and exosomes and the platelet-rich plasma, which we injected into the ovaries through the laparoscope and also through the ultrasound vaginally. And with this, we were able to improve the reserve and helped almost all ladies, at least to the tune of 50-55%, to have babies with their own eggs. Otherwise, they would have had to go for donor eggs. It's the dream of every woman to have their own biological baby, and this created a real change in their lives. And also, there are a lot of people who have a thin, damaged lining of the uterus, and this is because of infections. And we were able to use the same stem cells and the platelet-rich plasma to inject into the uterus and improve their linings, and thereby obviating the need to use surrogate mothers. So this was also a huge thing because every lady wants to carry her own baby. So after this, we thought it's time to focus on delivering normal babies. And for those who had repeated failures in their IVF and repeated miscarriages, we used the pre-implantation genetic diagnosis, whereby we use the lasers to take out a few cells, send it for genetic testing, and select a genetically normal embryo to put back into the uterus. So this was also a huge improvement because people were able to deliver normal babies and not use donor eggs and donor sperms. There are a lot of people, men, who have azoospermia, that means there are no sperms at all, or they have a very low number of sperms or a high degree of abnormal sperms. So we use the same stem cells and the platelet-rich plasma to help them also to produce their own sperms and have their own babies. Sometimes these sperms are not seen in the tests that we do, and therefore we have to take a biopsy from the testis and use it to inject into the sperm. So we used this technique called micro-TC, which is normally done with a 10-power microscope, but we had India's first 40-power microscope, and with this we were able to identify sperms in men who hitherto had no sperms in their previous biopsies, and with these sperms we were able to create babies with their own sperms. So all this technology helped us to improve our pregnancy rates, and particularly in the difficult and almost impossible cases. Today, there is a lot of rejection and immunology, and we are also focusing on that, and we do a lot of immunological tests and use all the medications which are necessary. We also take blood from the husband and create something like a vaccine, inject it into the wife, and we decrease this rejection, and we are able to give babies to those who have had repeated IVF failures and recurrent pregnancy losses. So with all this technology coming in, we carried on for a lot of years, and many people were coming from Sri Lanka and worldwide. But with the setback in the Sri Lankan systems, the number of people who came from Sri Lanka decreased, and this was because of the financial status of the population. They were unable to reach to Chennai. So we decided that it is time to start the center in Sri Lanka so that we would be able to offer them the same services. And Mr. Dinesh, the chairman of the Royal Hospitals, was very, very gracious enough to partner with and to support us in opening the Royal Prashanth Fertility Center in Royal Hospital, Bellavithe. And with his support and with the support of all my team, this dream of opening a center in Sri Lanka has become a reality today. So I have made it very, very clear that we will deliver the same high level of technology and systems that we have in Chennai, so that it is a mirror image of the systems that we have in the center that we have in Chennai. So today we have inaugurated this, we will be inaugurating this center. We had the puja in the morning, and the Honorable Governor and all the other dignitaries, we want all your blessings to make this center one of the best and to deliver the same level of expertise and to make every Sri Lankan couple who walks in go out with smiles and with babies in their hands. Once again, thank you very much for being here today to bless us in the inauguration of Royal Prashanth Fertility Center in Colombo, Wellington. Thank you very much.